Well, for more on this, we're now joined by Dr Jeremy Nel, who's the head of Infectious Diseases Division at Wits University. Dr Nel, thanks very much indeed for joining us. Welcome to the program. So we knew it was coming. We knew it was coming. We didn't know that it was going to be Omicron. We had in our mind, when we were talking about the future, perhaps variants that were known already. How much of a game changer has it been already?
Well, it's very early to know what the impact of it will be, but it is in some sense frustrating to have a new wave caused by a new variant every single time, like it is in South Africa, which is not true of every country, and it really just adds to the uncertainty around what this wave will bring. So far, so good. We're seeing a huge number of cases, but the hospitalizations do seem to be lagging a lot. And so, although it's very early and we certainly wouldn't want to count our chickens before they're hatched, I think a number of us are starting to wonder whether perhaps the amount of immunity circulating or some other factors is responsible for potentially a little bit less severity this time around. If that bit is borne out, we'll be very happy, but it's very early days and there's just so much we don't know at the moment.
All right, we'll talk about the severity just now, but let's talk about the acceleration, the surge itself. It's quite a lot. I believe it's more than we've seen before.
The rate of increase is dramatic and more than we've seen before. So the cases really from almost a standing start about 2 or 3 weeks ago in Gauteng are now exceeding the numbers we saw in the first and second waves in Gauteng. Still not at the level of the third wave, which really was the record for Gauteng at least. But certainly the number of cases have gone up. And again, the issue is the distinction between the number of cases and the number of hospitalizations, which are going up proportionately quite a lot. But we're really not seeing that level of number at the moment.
And what we're not sure, I guess, of those numbers. How many people have been reinfected? How many people are new infections?
Yes, there is some really good work done by some local researchers, so Julia Pulima and others, really suggesting that probably we are seeing more reinfections this time around than we did with previous waves. But again, that should be distinguished from the severity of those reinfections. Certainly, reinfections are not going to be a troubling thing if they lead to only mild disease. But we do seem to see more reinfections this time around, both anecdotally and in the data as well.
And those reinfections are going to include people who've been vaccinated?
So it's at this point very difficult to know what the proportions are because there's a challenge getting hold of all the vaccine data and integrating it with the other data. I wouldn't be surprised if vaccinated people also fall foul to reinfections. But again, the role of vaccines is really not to prevent mild disease. If it does that, it's a bonus. The role of the vaccines is to prevent severe disease. And at the moment, there doesn't seem to be any source for concern on that front.
Yeah, and as you said, it looks very different in terms of the hospitalizations, the deaths as a proportion to the new infections this time around. I remember the third wave, that was a major concern. What do you think is happening?
Yeah, it's the million-dollar question. And so the first thing to say is that we do need another week or two perhaps to be sure of any of this. And, we always see hospitalizations lagging behind cases because it takes a while to get severe disease. So that's one component of what we're seeing. And then the question is, does all this immunity that we really do now have in the country, both from natural infection, which is the majority, and some from vaccines as well, that we hope should be protecting against severe disease with this new variant. And that may well explain, if it's borne out that it appears to be a less severe wave, we'll have to wait and see. But that may be one of the reasons why this is a bit less severe, because of all the immunity circulating from the previous waves and from vaccinations, of course. So cross fingers and holding thumbs, but and it's very early days. But if this does pan out a little bit less severe, you'll have a lot of very grateful healthcare workers on the front line.
Is it still the same trend where that by and large, the majority of people that are hospitalized are people who are not vaccinated?
Again, very difficult to tell because it's been such a short period of time, and this really the vaccine data is locked away and not not easily accessible. But certainly anecdotally, that does seem to be the case. And that's what you'd expect, given the fact that the vaccines do seem to have a pretty protective effect against severity. For this particular wave, we'll have to wait and see. But again, some early data from the Western Cape and others suggested that the vaccines are still offering a pretty good protective effect here, although again, smallish numbers and early to say for sure at this point.
All right, but wave 3, it seemed to be almost, if you got vaccinated, you weren't going to get hospitalized, which is why vaccination is so important.
Sure, that's been, that's the safest way to get immunity. I mean, the alternative is to get it from natural infection and take your chances, which really is not nearly as safe as getting it by the vaccination route. And of course, even if you've had natural infection in the past, vaccination can still boost your immunity to quite a far greater degree in the way that's really beneficial. So yes, I mean, certainly the previous waves, the vaccinations did their job. And again, I'm pretty confident it'll be the same here too. The vaccines, while the new variants come across and they may not protect as well against mild disease, all of the vaccines have protected excellently against severe disease across all of the variants. And there's reason to believe it'll be exactly the same with this new variant. So fingers crossed, but that again would remain one of the key health interventions to get as many people vaccinated as possible.
So there are more than 20 countries now that have got Omicron virus. They probably are watching us simply because of the numbers that we have. But are there any lessons that we can learn from maybe neighboring Botswana at this stage, or are we still the ones that are really sort of charting a line here?
We have the most data available and the most ability to sequence the virus in the region here. So probably for the region, the best data will come locally, although again, every bit of data from everywhere is welcome. I think one of the key questions is if natural infection is really the thing that's mostly protecting people here, because we don't know, there's a lot of natural infection. There's only about a third to just more than a third of people being vaccinated. Will the same pattern hold in places like Europe, where there's a lot of Delta as opposed to very little here, and where the majority of their population is vaccinated? And again, that'll be an open question. My hunch is it'll be much the same there, but it will certainly be interesting to see how it plays out in other parts of the world where the circumstances are a little bit different.
We hear the politicians tell us that there's no science behind shutting borders and, keeping people out. Explain that science for us, so that our viewers can really understand why there is no reason why Boris Johnson is keeping us out.
Yeah, the travel bans for a virus like this are really silly. And one of the reasons is by the time you detect it, it's already spread. It's had weeks on you. I mean, South Africa sequences less than 1% of the positive tests. In other words, less than one in 100 of the tests that test positive will look and see which variant it is. Other countries might be in the richer parts of the world slightly more, but still all countries are only checking a very small proportion of their positives to see what type of virus it is. So by the time it's already become noticeable in South Africa, weeks have gone past and this virus has spread across the world already. And we're seeing that. I mean, we already, in the day after the travel bans were identified, 3 other countries around the world, one of which had no link to South Africa or Southern Africa at all, showed that they already had the same variant. So these variants always spread. Really, this virus is very good at spreading, but also by the time you detect it, it's already had a few weeks to spread beyond the borders. And so shutting the borders really doesn't buy you anything apart from a tiny amount of extra time. And really the cost on the recipient end, in other words, the cost to the countries which you are banning, is enormous. So one thing I really hope that will come out of this is that the world will be more woken up the next time there's a variant to not do these stupid travel bans, really, which cause a huge amount of cost and don't really benefit the country banning the others. You don't get much more time. The variant is already in your country, and that's been seen in the UK, amongst others.
There does seem to be a bit of an obsession in trying to find the source where a virus started or a variant started. Is that useful medical information?
Look, on some level it is, because it would be nice to know what sort of factors drive the variants to evolve in the first place. So finding exactly how and where it started might give some clues as to the sort of things that generate these variants. But, to a large degree, it doesn't matter where it started. Firstly, the country which discovers it, like South Africa, is not necessarily the country of origin. And we know this in Southern Africa, where the sequencing here is much more full. And so it could have started anywhere, for example, in the Southern African region, and just South Africa was the first to detect it. So detection doesn't equal where it started. And also, where it started is, as you said, is somewhat irrelevant. The treatment is the same. The epidemiology is the same. The way it spreads is the same. It doesn't really matter where it started. So it's an interesting scientific question for a corner of this, of this whole epidemic. But really, it's not a key question. The key questions are really what the characteristics of the variants are. How are they spreading? Is there any differences to the previous strains? And to get those answered much more quickly than really to identify exactly where it came from.
All right. So as an infectious diseases expert, what is of interest to you in the next 2 weeks?
Well, I think the big question, and this is something we're going to have to get used to, because the waves are going to keep coming, I think. I think we'll have variants and waves for a long time yet, and maybe for many years, and maybe for even longer. And I think what we have to get used to is asking really just one or two fundamental questions. Is the new kid on the block, the new wave, is it caused by a variant which in any way is going to cause more severe disease, especially among those people who've got some immunity from vaccination or past infection? And if the answer to that is no, if it's not going to cause more severe disease in people who previously have immunity, and that's the answer we've had so far with all the waves, then a new variant is not of huge importance. You might see a lot of cases like we're seeing at the moment, but if it's not causing a lot of hospitalizations, the impact of that is really going to be quite limited. And that should really be our focus going forward. So we're really trying to find the question is, are we protected from severe disease? Because if you are, then I think that's as much as we can hope for at this point, and that's more than enough.
Is there enough evidence now to suggest that if we get a majority of a population vaccinated, it reduces the chances of new strains?
That seems pretty likely, and there is some evidence to support that. But again, because there's so few new strains, it's very difficult to tie that together. Yeah. But it does seem likely, because we know that people who are vaccinated clear the virus a bit quicker. They're also less likely to transmit it to the next person. And when you put those sort of factors together, it does seem likely that a vaccinated person, or a population that's highly vaccinated, may well be at less risk of developing these new variants. Again, there's many factors, and we don't have a lot of new variants to look at in terms of the data. But again, that does seem like one of the potential benefits of vaccination. All
right, Dr. Nel, we're going to have to leave it there. There's a whole other conversation we can have about boosters and children, but that's for another day. Thanks so much indeed for joining us.
My pleasure.
All right, that's Dr. Jeremy Nel, who is infectious diseases head at Wits University, speaking to us there about, the wave that's just hit us. And if you didn't believe we're in a fourth wave, well, it's happening. And so you need to be careful out there.